It's been 8 years with 16,000 doctors on the subscriber list. I'm sure that there's plenty that you can tell us about the trends that you're observing, about expectations doctors have in terms of what their careers, how they can position themselves. So what are you observing? To which extent are doctors just looking for something to enrich what they're already doing, or to which extent do they really wish to leave medicine? And I'm really wondering about what the trends here are, because we know that the shortages of the medical workforce are one of the biggest challenges that healthcare is facing globally.
I would say the vast majority, again, it's quite difficult to quantify this, but the vast majority, I'd say at least 50% of doctors are looking for other opportunities because they are burnt out, they're stressed because of their work or the way they've been asked to work, they lack autonomy in their jobs, and they're just looking for a way out of a place that they just don't really like to be in. And they need a lot of support in doing that. And the thing is, these are the doctors that come to us or come to Medic Footprint's website and look around. But what I worry about the doctors that are feeling that same way but don't even have time to really explore other options because they are so busy. Another proportion of doctors, they are interested just in expanding their portfolio of skills beyond clinical medicine. As we know, there are plenty of opportunities for doctors to do that in healthcare, in health tech in particular, outside in consultancy, pharma, management. You set up your own business, you name it. Doctors are great entrepreneurs. And so there are lots of doctors just looking for support in exploring that. And there's some doctors who, again, going down specifically the leadership track. They're looking to become leaders in a non-clinical capacity. Again, it links to the second point where there's plenty of opportunities to do that. But it's like, how do you communicate who you are? How do you market yourself, not only as a doctor, but as a leader of a company when you haven't had that experience? And as I mentioned, a lot of doctors don't really know how to do that. They're not very, especially in the UK, they're not very good marketers of themselves. They totally undervalue themselves and undersell themselves. And they need support in doing that and navigating the world of work, which is very different in healthcare, particularly the public sector, compared to in the private sector or the wider sector.
With the digital health space growing, there's a lot of need for clinicians to take part in the private sector, be involved in the building of products. So how do you observe the changes in this end? Do you get a lot more offers for doctors from the digital health space? How is that changing? Who is turning to you as the client looking for doctors to work for them?
We work with a range of clients at different stages, but the main clients that we work really well with are those that are growing, they're scaling. So usually post Series A. Some need very specific types of doctors and leaders, and some need a bunch of doctors over time. Doctors are they're highly talented people, and they're expensive as well. They're expensive people. So you really want to hire the best and specifically the right doctors for your company. So we help companies to really define what kind of doctors they want. So for example, telehealth company needs GPs. Saying you want a GP is just not enough. You want a GP who is going to really help grow your brand, refer more really great GPs in, provide a certain level of service, maybe even leadership in some ways. So you need to be thinking forward. What kind of GP do you need, speaking to clients, to scale the company? And I think that the mistake that a lot of clients make, especially when they're using kind of generalist recruiters are great in many ways, they fill in the gap in many ways, but if they're not specialists in that area, they will just find any doctor. And doctors are quite discerning, number one, so it can take time to actually onboard them and get them to say yes. And two, doctors are probably particularly the ones on LinkedIn, are getting approached like all the time. So unless you have a really robust, say, talent acquisition strategy, so that's not only acquiring but also retaining, then you've got a high chance of losing that doctor. And the cost of that is hundreds of thousands easily per doctor. There's a lot of hidden costs in that. So our role is really to make sure that the companies have a really solid foundation in their strategy and that they support doctors in their growth and with their growth, because it's a circle. So you pay in, you'll get out, and you save a lot of money compared to recruiters over time.
It's interesting that you mentioned how many offers doctors get. So I really wonder to which extent do doctors really even need to market themselves? How do you work with doctors given that they have a lot of opportunities? To which extent do they really need to invest in their personal brands, and to which extent is
Yeah.
that unnecessary because we've got workforce shortages?
So the reality is, like, most doctors are not on LinkedIn. Most doctors are, if you're looking at social media, I think the vast majority are on Facebook or Twitter. Twitter, let's ignore Twitter because that's a bit of a different platform where it's more outgoing rants. A lot of doctors turn to Twitter for ranting, let's put it that way. Ranting about their lives and their work. On Facebook, there are a lot of private groups that are doctor only, particularly alternative careers for doctors, over 40,000 people, doctors in those groups, and that's just one. And so that's one of the resources that we use to promote any opportunities that come up. But we find that doctors are on LinkedIn. We advise a lot of doctors go on LinkedIn if they want to be found to get a job. But again, not all doctors necessarily know what they want. And when you're talking about selling yourself, it's a two-way street. Our job is really about connecting the right doctors to the right jobs because we see the consequences of that not working very well. And so that's why you really have to work with both. When it comes to doctors marketing themselves, they need to learn how to market themselves because some jobs would be really appropriate for them more so than others.